Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 3 types of aphasia and less common ones. The three main types of aphasia, which involve trouble speaking, writing, or understanding language, include Brocas, Wernickes, and global aphasia. /r/n/r/n aphasia happens when a part of the brain associated with language, the frontal lobe, the temporal lobe, or the parietal lobe, is damaged. It is most common after a stroke but can also be caused by a traumatic brain injury, a brain tumor, or an infection of the brain. Less common types of aphasia also exist. /r/n/r/n illustration by Junior B for Verywell Health /r/n/r/n Several regions of the brain control language. The language function is located in one hemisphere, half, of the brain, which is called the dominant hemisphere. Typically, the dominant hemisphere of the brain is on the opposite side as your dominant hand, the hand you write with. /r/n/r/n areas of your brain are important for communication in different ways. /r/n/r/n if one of the language regions of the brain is injured but the others are healthy, only some language functions are affected. Each type of aphasia has a unique set of symptoms based on the affected blood vessels and areas of the brain. The three most common types of aphasia include /r/n/r/n of the three main types of aphasia. Global aphasia is considered the most severe form. It affects all aspects of language, including reading, writing, talking, and comprehension. /r/n/r/n roughly 1 in 3 people who experience a stroke will develop aphasia. How aphasia is expressed will vary greatly according to the type and the individual, or even within the same person. /r/n/r/n Some systems for classifying aphasia refer to fluent and non-fluent types, depending on how speech and language are affected. Brocas aphasia, named after the person who discovered the area of the brain responsible for creating speech, is the most common non-fluent type. /r/n/r/n Brocas aphasia is also called expressive aphasia or motor aphasia. The term indicates that the ability to speak is damaged but other language abilities stay mostly the same. It can be frustrating for people with Brocas aphasia, who are aware of speech changes that include /r/n/r/n damage to Brocas area happens when a stroke interrupts blood flow to the dominant frontal lobe of the brain. Other post-stroke problems related to the affected areas include /r/n/r/n Wernickes aphasia, also known as receptive aphasia, is the most common type of fluent aphasia. It is named after the person who discovered temporal lobe areas of the brain used to understand language. /r/n/r/n Wernickes aphasia is challenging because when people speak, they usually feel as though other people should be able to understand them. They do not realize that their language is impaired, and they don't understand othersor or even themselveswhen they speak. Those who have it may, /r/n/r/n however, people with Wernickes aphasia after a stroke may eventually learn that others cannot understand them when they speak, a realization that can lead to anger or fear. Depression is common after a stroke, affecting between 30% and 60% of post-stroke individuals. /r/n/r/n Someone with Brocas aphasia may use short phrases like walk dog to explain what they intend to do. Their words are typically limited. A person with Wernickes aphasia may use a lot of words but they don't always make sense. Nor do they always know it's unclear. /r/n/r/n Global aphasia after a stroke occurs when the brain damage is so widespread that it involves more than one left hemisphere language area, leading to both Brocas and Wernickes aphasia symptoms. /r/n/r/n Global aphasia affects all aspects of language, with some people unable to speak or communicate at all. This can affect different domains of language, leading to /r/n/r/n People experiencing global aphasia often rely on facial expressions or hand gestures to communicate. /r/n/r/n. Other types of aphasia can result from different areas of damage in the brain. They include /r/n/r/n. After a physical exam and review of your medical history, imaging studies, and evaluative tests would be ordered to help confirm the cause and characterize the nature and severity of aphasia. /r/n/r/n. Imaging studies typically include /r/n/r/n. MRI is the most accurate way to detect signs of a stroke, but a CT scan is faster and more widely available. Healthcare providers often use CT first in people with a suspected stroke and MRI afterward to get a more detailed image. /r/n/r/n. You would likely be referred to a speech-language pathologist to undergo a battery of spoken and written tests to characterize the nature and extent of aphasia. The aim of the Comprehensive Aphasia Test and other language assessment tests is to determine if you can, /r/n/r/n. These tests help to determine if you have aphasia or another disorder with similar symptoms. Some conditions that can also cause communication difficulties include /r/n/r/n. Aphasia treatment depends on individual needs, and people have different or more than one type of treatments. For example, a person living with post-stroke aphasia may benefit from /r/n/r/n. Unquestionably, the most important aspect of treatment for post-stroke aphasia is speech-language therapy. This can be done with individual or group therapy, with the aim of /r/n/r/n. Some researchers are also exploring whether experimental techniques like deep brain stimulation can help people with aphasia. /r/n/r/n. You can help people affected by aphasia to communicate. First, establish their full attention and limit background noise like the television, and then /r/n/r/n. Aphasia is a language disorder that is caused by an injury to specific parts of the brain that control language. The three most common kinds of post-stroke aphasia are Brocas aphasia, Wernickes aphasia, and global aphasia, which all affect your ability to speak and or understand language. /r/n/r/n. Aphasia after a stroke is common, but a traumatic brain injury or brain infection can also cause aphasia. Treatment may include speech-language therapy, medications, counseling, and mental health support. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.